Hey, everybody, it's Elizabeth Hamlet bringing you an exciting guest today. I am so pumped up for this talk today. She is the author of the College Student, I'm very bad at this, the Ultimate College Student Health Handbook. You can see all of my tabs. It's been literally decades since I was in college, but boy, did I learn a lot about this. And actually, I'm just going to keep it as my own reference because I get migraines and I get bug bites and I get sore throats and have found this to be incredibly helpful. So, Dr. Grimes, if you would mind just telling us a little bit about your background and how you
Certainly.
came to write this particular book. And let me just ask folks, if you are watching us live, we are monitoring comments and questions. So please go ahead and comment here or ask us a question.
Absolutely. So I am a board certified family physician. I did private practice for about 20 years and in Austin, Texas. And I also, during that time, became a speaker for the American Academy of Family Physicians. I became the associate editor of the 5-Minute Clinical Consult textbook, which was those like really big books back there. And I started writing books. And we have 2 daughters who are freshly out of college and graduate school. And as they were growing up, I started giving first aid kits for college as high school graduation gifts. And I would literally make these kits like this. And I was also a Girl Scout leader and I love crafting. So I had great fun making these kits. And the very first one I gave was to our next door neighbor babysitter. And I took it over there. I was so proud to give it to her. And her mom's like, yeah, but Dr. Jill isn't going to college with her. She doesn't know when to use any of this stuff. So she runs in her kitchen. She gets an index card out and she says, okay, when does she take Tylenol versus Advil? She's like asking me questions and writing all these notes down. So the next year when I made a couple, I included a couple index cards. And by the time our girls were graduating high school, I had a 20-something page laminated booklet, laminated because I'm telling you, I like to craft. I live to laminate. These things are fun for me. And meanwhile, I'd written 4 other books and I'm like, before our kids go off, this is how much information I want to send with them. So it became a book. And it took me so long to get it done that actually our younger daughter, who has a degree in animation, she was in college when it was published. And she ended up being the illustrator for the book, which is really fun. She had worked for another publishing press as an illustrator. And so that was a completely unexpected fun surprise. So it's a mother-daughter effort.
I want to ask the question, do you sleep at all? Because you are.
No. There's very few things. I generally practice what I preach.
Mm-hmm.
I have very little caffeine. I eat really well. I exercise every day. I'm working on my sleep.
It sounds like you would have to. So anyway, for those who are just joining us, it's the Ultimate College Student Health Handbook. If you have a kiddo headed to college in the fall, you absolutely want to make sure this goes with them. You started, as you said, as a family medicine practitioner. Were there surprises for you when you started working at a college?
Yeah, so I forgot to actually say that. I did. So I was in private practice for 20 years, did all those other things along with that. And then I went to part-time college health. I had volunteered or worked a couple times here and there literally over the 20 years. But then I ended up actually working at the University of Texas part-time, mostly in their urgent care department. And I had 2 big surprises. And I love this question. No one's actually ever asked me this before. The first surprise was that having been in private practice in the same town, literally just a few miles from campus, I was thinking, oh, this college health is going to be kind of cherry picking the easy stuff. It's going to be sore throats. And it's what people think about family medicine. So I don't know why I thought this, but I honestly was thinking it's going to be young, healthy people. It'll be pretty easy.
Absolutely.
And then it turned out in urgent care, literally because people who urgently need to be seen, and they're from all over the world, there's college health is hard. You've got people with rare diseases that we've only heard about as a sentence in a textbook in medical school, that they're showing up with this disease you've never seen. And it's a chronic thing and whatever. You've got kids who are cancer survivors. You've got obviously type 1 diabetics. And so it was much more complicated than I thought on the front end, which was kind of funny. That was a laugh on me. And the other is that I was actually really surprised at the amount of alcohol and cannabis abuse that I saw. And that is not unique to where I was. And I do not speak for the University of Texas. I want to say that. Every single campus and every single school in the United States has the same issues. And but it was just interesting to me to see the magnitude of it, because in my smaller sample in my private practice, I hadn't seen as much of that.
And what's interesting about that is, one point, again, you make in the book that I really, really liked, was that you certainly were seeing abuse of alcohol and drugs, but you also let students know that the stats on how many of their peers are not even using drugs and alcohol.
Yeah. So I just want to say this here, or I say it everywhere, that 20 to 30% of college students choose not to drink alcohol at all. And there's nothing wrong with that. And they are perfectly happy. It really depends on your subgroup, your culture in college, what percentage of your peers drink. And there are some groups where some people drink and others don't, and nobody cares. Others, there's a lot of peer pressure. So, if I go in and I tell pledging frat brothers that 20 to 30% of people don't drink alcohol at all, they're going to think I'm an idiot. They're literally going to think I don't know what I'm talking about. If I go to a different group that maybe has a religious bias against drinking, none of them drink. And they would be shocked to hear that, 70% of college students do drink. So, you got to know your audience. But yeah.
Yeah, I would imagine so. So I asked you what surprised you most about moving, from family health to university health. What did you see when you were working at the college level that you think would surprise students themselves the most?
I think the biggest surprise to students is, and which was also true in my private practice, is that these beautiful, smart, intelligent, fabulous, highly selected people might have STDs, sexually transmittable infections. That they just, my first book, I literally wrote a book about this, because who doesn't want to read about STDs? But reads like episodes of Grey's Anatomy. Trust
at
me,
the beach where everybody can see it.
Yeah. Exactly. Let's have that book sitting out. But the whole point is that infections don't care how much money you have or how smart you are or where you live. And everybody has them. They are common, and young people are sexually active. Again, not everybody is sexually active. You don't have to do that either. 30% of people don't do that either. But for those that are, particularly with the hookup culture right now, and the ease of it with apps like Tinder, and other apps.
That's so interesting. I didn't think about how much easier it'd be to find somebody these days than back in the Stone Age when I was in college.
Right. And it's this, I don't have any moral judgment about that. That's everybody's individual choice, which whatever they want to do. But it's really important. A lot of times young people will really want to hear me say that hookups are safe and it's not a big deal. And the reality is, the more partners you have, the more at risk you are for getting a sexually transmittable infection. And as long as you know that, and you take appropriate precautions, and you get tested regularly, that's a choice. You can't have a car accident if you don't ride in a car, right? But most of us choose to drive in a car, especially in Texas. We all have cars. But I think you just have to be aware of that. But that's what would surprise students the most. And the subset of that, not to be overly graphic, but the subset of that surprises people is that they don't think that they can get an STD from oral sex.
Right. I mean, you made it clear too. Also, and the good news is all of that is preventable.
Yeah.
All of that. So I think what I really like about this book is that, again, you make sure that students have the stats on how many of their peers aren't doing certain things that everybody imagines is going on in college. But you also speak to them very directly. I mean, I love the way this book is written. It has humor. I mean, all the titles are, really
I
funny.
love puns.
Yeah.
It's my thing.
There's alliteration.
Yes.
But you really cover everything, and there's no moral judgment, as you said. You see these facts, you present them, including, certainly how to help yourself when you are too drunk to see straight, how to help a friend who is ill. So you really normalize the idea that people are going to do this stuff, and you don't pass judgment on their choices. You give them the facts about what's dangerous, with drugs, and things like that. And what informed your choices about doing that?
About that tone.
In other words, about how
Right.
how to present this information to
Because
them.
I mean, I have always preferred as a group, like teens, tweens, adolescents. I love the potential that's there. And I think I may have felt not always heard as an adolescent, just like in the world. I had a really great supportive family. My dad was a professor. My mom was the everything mom and the homeroom mom, the Girl Scout mom, which is why I love doing all those things too. One of the reasons. But I mean, there's no point in having judgment in medicine. And I can totally disagree with somebody on something, whether it's politics or about smoking. I really hate smoking. Smoking is bad for you.
Yeah, smoking.
No matter what. But
And
I don't think you're a bad person
Yeah.
if you choose to smoke. And from really almost 30 years of practice now, which makes me sound ancient, I know how many people who smoke want to quit. It's not like they don't want to quit. I know how many people are obese that want to be thin. Like there's so much more to all of these things. And I have, in general, learned in my life, every time I thought to my smug little self, well, I would never do blank. Sure enough, next week I'm doing blank, It's just like there's no point in that. And I can't help people. I went into medicine to help people. And I think what's helpful is just to lay things out there. And I've had so many young people, young adults that basically just had misconceptions about whether it was about the Gardasil vaccine, the HPV vaccine, which I think is an outstanding vaccine, prevents cervical cancer and is probably preventing oral cancers as well. But about that, or about cannabis, and it's not, I think just having a discussion about it, or talking about nicotine and how that works, and why does it why is it so addictive? And because gosh, we went through a phase, right? It's interesting with the whole juuling, the e-cigarettes, vaping, still way too common. But there was a phase where it was just like everybody in middle school was doing it. How do we get there? So I think it's just really important not to judge and to just be able to have conversations.
That's what I really like about this too, because it does seem like there isn't any stone unturned, including bug bites. And hearings that are too stuck in the back of your lobe. I mean, I literally can't think of anything that happened at college that you don't cover. So I asked you about what you think would surprise students. What do you think in reading this book might surprise parents? Is it the same answer?
I think that parents don't have much of a handle, pun intended, on alcohol drinking these days. And that when most parents my age think about college students and college drinking. They're picturing beer. Worst case, they're picturing kind of beer bongs. And yes, I mean, they know that there's shots out there, that kids doing shots, Jello shots, whatever. But I don't think they quite understand that there is a big cultural push, again, in the groups that drink. Okay, there's a rallying cry of blackout or back out.
Oh,
And
God.
people intentionally going to get blackout drunk. So can we talk about that for a minute?
Yes,
So,
please. I mean,
okay.
yeah.
So blackout is not passed out. Passed out is unconscious.
Okay.
That is alcohol toxicity. That is clearly very dangerous. If someone is unconscious, we need to get them help. And how do you know if somebody's unconscious, whether versus they're just asleep, drunk? If you cannot wake them up, shaking their shoulders, trying to get, if you cannot wake them up, you need to get them help. That's just easy. Blacked out, though, means that you drank enough to too quickly, too high, raise your blood alcohol level, which happens when you do shots because, they're this big, takes literally 1 second and there's multiple ones done. So you're drinking a large amount in a short amount of time. Your blood alcohol level shoots up too high, too fast, and it actually turns off your hippocampus in your brain, which is what takes short-term memories and makes them long-term memories. So you have no long-term memories for some portion of the time that your blood alcohol level went up that quickly. And so the next day you have a blackout, a deficit of those memories that you will never get back. You might see pictures of you doing something, but you're not going to have any true memory of it because you didn't create the long-term memory. Now, this really gets important when you have been physically intimate with somebody and issues of consent. Obviously, if somebody is drunk, they cannot give consent. That being said, a lot of people are sexually active when they are drinking. And there's this whole, were they drunk? Were they not drunk? But the problem is for consent, you want ongoing, verbalized, enthusiastic consent. That is that's our definition of consent these days. Okay. Ongoing, enthusiastic, verbalized consent. And you might have that from your partner that you're being intimate with, but the next day, if they have a blackout memory loss because they were doing shots, they're not going to have memory of giving that consent. Wow. So you can see where this is going. So this is problems, and this is so not gender specific, not gender nor sexual preference specific. This is a problem across the board for everybody.
So, which I think is a good lead into a question. You have maybe met parents who say, well, I don't know why all this stuff is in this book. You said it was a health handbook, and my student is not going to do drugs, and my student is not going to drink, and is not going to have sex. So, it's as a parent, it's a leap of faith sending your kid off to college just as a concept in general. And, some of this stuff for some parents, and I think they should read it also on buy 2 copies, folks. Keep one at home. Send one to with your student to school. In part because maybe if they're so sick, you should be able to look stuff up.
Yeah, then you just go, oh, hey, your sprained ankle. You want to know whether you have to have an X-ray? That's on page 98.
Yeah, so it's a good companion.
But what do I say to parents who think that their kid doesn't need this information because they don't drink, they don't smoke, they don't have sex?
And they will not because they know that it's bad stuff to do.
So I have 2 things to say about that. And the first is that, you know what? They need it so they can help their friend, their roommate, their classmate. Because I can guarantee you they are going to be somewhere where somebody else is intoxicated or was roofied. Somebody slipped something in their drink, which we could talk about. Or the roommate, has an STD. It's not just for you. It's so that you know when and how to help others. And it's not your job. They're not little physicians running around in college, but just, this is good knowledge. This is being a good community member, for one. The other is that having practiced in private practice for 20 years, I have taken care of many, many many, many people who are doing many things that their parents are not aware. And the parents, have sworn to me up and down, left and
Yeah.
right, not my kid.
And that's when their kids were in
So-
high school too.
Mhm. And middle school.
Yeah. In
Yep.
middle school. Yep.
But so, I mean, and I'm not saying this that your kid is lying, your kid, it's doing stuff you didn't know. But the thing is, it happens. I'm just,
Mhm.
again, this is just a pragmatic, not a judgment thing at all. This is just, hey, it happens. There's peer pressure. Also, we all make mistakes, and kids are not immune from making mistakes, and they actually have less impulse control. So they make more mistakes. And, it's just part of the human condition.
Prefrontal cortex not fully developed
Yes.
until what, 25 now? What is it? Somebody
Yeah.
said
Yeah. I mean, the general thing is 25. It's not like the brain completely stops remodeling, as you know, at 25. We're still learning pruning. We're doing all these things in our brain. But the biggest, most rapid changes seem to finish up around 25. So.
Mm-hmm. So for those of you who are just joining us, I'm watching the viewer count. We are here with Dr. Jill Grimes, who is the author of the Ultimate College Student Health Handbook. And
Subtitle, Your Guide for Everything from Hangovers to Homesickness.
Oh, I'm sorry. Yes.
Just throwing that out there.
She's very, very clever with alliteration, and titles are just darling. So, and including the one about, STDs. Yes, it happens to people like you.
Mhm.
And it's so well organized too. So this template for folks, who say, "Oh my gosh, my kid is not going to read this thing." It doesn't matter because
They're not. I'm not going to read it. You're not going to.
I did. I read it cover to cover.
Okay. I didn't. My kids didn't. It is I have a problem. I need to look this up. It's also for kids. There's, everyone's got different personalities, but your kid that is that go-getter, that's like ready to go off to college, ready to take over their own healthcare, ready to do these things. I'm telling you, this is one of those books that gets kind of like passed around. Like, it gets left open to a certain page. I've had parents tell me they put a $20 bill, like in the drinking chapter, another 20 somewhere else, strategic, just encourage them to open up the book. But it's a read it when you need it sort of thing.
Mm-hmm.
But it is helpful. Like if your kid is top of the class, going to a super competitive school, and now going to be with only other people who are all top of their class, especially test anxiety is huge, and it's higher. The higher up you go, the more test anxiety there is. And so there's stuff. I have stuff in here about insomnia. What if you can't sleep in your dorm room, and how ways that are actual practical ways to deal with test anxiety. And so those are the kind of things that kids who are a little, they're go-getters, and they just want to be super prepared. They're the ones who took the extra practice test for the SAT. They're going to read it, but or at least parts of it.
Right.
But the main thing is, I didn't design it to be for that. I literally just wrote this as my extended laminated first aid kit explanation to be parked right with the first aid kit.
Well, and I think as you say, I mean, I'm somebody who, once I got started too, it was just addictive. I just had to keep going and see everything that you covered. But yeah, for those who want to dive in, I mean, for me, as a learning specialist, I would think it would be ideal to try to get your student to read it before they go, so that if they have questions or they're concerned, it could be a really good opportunity. We know that they, what is it, soil the nest in this summer coming up before they go freshman year. And if that is a new concept to you, if your current high school senior, soon to be grad or already graduated student is starting to just pick fights with you, things are not going well.
Not like their friends.
Yeah, it is all very typical. It is not just your student, your family, your situation. Talk to other parents, because it's referred to as soiling the nest. Like, in order to get up the whatever they need to be able to leave, they've got to make this place a place they have to leave, right? So
exactly.
But it all is, to me, then about thinking ahead. So as the learning specialist in me wants everybody to read it before they go, so that, again, maybe there's some things that they are worried about. I mean, maybe they've read enough books, seen enough movies. And
Also, there's little things like this is a really awkward thing, but I put it in the book because this was something I was a bit surprised about in college. Um, there's a lot of people who have a real fear of going to the bathroom, pooping
mhm.
specifically in public restrooms. And you have gone from living in your own home, a lot of times with your own bedroom, maybe even with your own bathroom that you don't even share, to now you're in a situation where you are forced to share a bathroom. And we see kids with constipation and abdominal pain that they don't even realize is constipation because, they're 18. Like, who's had constipation at 18? And so they're in with abdominal pain, and it turns out they really have fear of using a public restroom. And
Mhm.
so, like, I I have that in there, and um, I think just knowing that other people have that is
Yeah.
helpful. I've had students tell me, I have to tell you, I honestly thought I was the only one. I thought it was so weird because I
Yeah.
had that, and you made me feel better because you told me that other people have the same problem,
I
or
think
insomnia, same thing.
Yeah, I'm sorry. I get all excited. Yes, and what I was going to say is, I think everything about this book normalizes all of that stuff. And I mean, some people may be surprised. Here's the health handbook. You talk about homesickness, and a lot of people are going, "Well, why is an MD talking about homesickness?"
Because it is a huge source of anxiety.
Hmm.
And the number one everything that's involved, because homesickness isn't just homesickness, it's loneliness, it's anxiety, it's social anxiety of meeting other people. And so let's talk about a few things that you can do actually proactively this summer to help with that.
Oh, that'd be great.
You/meaning your kid. So I have a rule of three. The first thing is to join 3 clubs, organizations. And note, I'm saying join. Okay. So your kid's going to go on the website for their college. I promise you, big colleges have well over 1,000 clubs. Small ones have like well over 500. It's amazing to me, and how universal they are. They have everything. My younger daughter was in juggling club. She didn't know how to juggle. And
Yes.
almost every school has a juggling club. 2 schools have a circus. You
I
literally
have
can.
seen, what's the zombie game?
Oh, yes, zombies, and
Uh,
it's outside chasing,
yes,
zombies and something
there's
else. Yes,
yeah.
but ultimate frisbee, Harry Potter club, bad movie club. A lot of places have the bad movie club where they get together once a week and they literally make fun of a movie. They're like talking during this is very millennial with, they can be texting, talking, eating, and watching a bad movie. I just think that's hilarious.
Yes.
But anyway, so join 3 clubs. Plan to find the 3 clubs that you want to join and make them wildly different. A service one, um, a sport one if you're a sporty person, or a sport one if you're not a sporty person. Maybe this is part of reinventing you, and you didn't do any sports in college, but you know what? You want to do intramural kickball. Whatever, ultimate frisbee, whatever. So just different things, because if you're only counting on joining that sorority or fraternity or the elite dance team or the a
Mhm.
cappella group, and you don't get picked by the one you want, that is a really, really common experience and a really hard way to start the semester. And you will be homesick. You will be sad because your whole vision of what you thought your college experience was going to look like based on this one super important group to you to join is now shattered, and you don't have anything else to fall back on. So that's the first rule of 3 different groups. And will you keep up with all 3 of those groups? Probably not. You're going to find that some jive with you better. You make friends in one and don't like the crowd in the other. And that's why very diverse, to just
Mhm.
pick 3 different things. The second is to get 3 events on your calendar for that first 3 weeks. Okay. So and in the Southeast, it's gonna be football. It's gonna be one of them. Even if you don't like football, most people still go. It's a thing, but it doesn't have to. And if you don't like football, you don't have to go. but get 3 things on your calendar. Again, pick different things so that you kind of meet different people, and you can ask, hey, I'm going to this art exhibit. I'm going to this concert. I'm going to the Greek food festival, pick just, again, different things. So 3 clubs, 3 events in the first 3 weeks, and the last 3, you're only going to look at social media 3 times a day. Set a time limit, and it will not be the last thing when you're in bed, because the fear of missing out, the FOMO, I mean, nobody posts, oh, I'm in my new school and I'm sad. Everybody posts, yay, look at me. Wow,
Yeah.
so awesome. And so you will convince yourself you're the only person on the planet that's struggling. That's guaranteed if you do that. So 3 times a day, 10 minutes, 3 times a day. So you're keeping in touch, you're seeing what people are doing, but you don't want to doom scroll in your bed at night. That's just a bad idea.
Again, normalizing all of this stuff, because I do think, it's so easy to get this feeling like college is, I'm going to reinvent myself. It's going to be great. It's going to be like the movies. And, I mean, even if it is good, it isn't always living up to students' expectations.
Right. And I always tell people, I usually end with this, that how many times do we say to a young person headed to college, oh my God, it's going to be the best years of your life, right? This is ingrained in our culture. It's the best years of your life. It's the best years of your life. I certainly hope not. I mean, do you want to peak at 22? Are you kidding me? I hope it's the best years so far.
Right.
Yes. But even great years have bad days, bad weeks, and sometimes bad months.
Mm-hmm.
And that's okay. And we don't talk about that. And our kids grew up. My husband has 8 roommates from college, and there were 5 of them that lived together, and they rotated who lived with who. But there's these 8 roommates,
wow.
And we still get together with them all the time. So much fun, great group. Like that's, and I'm very much in touch with my college friends too. Not all of them, not as much as he is, but we have the aunt and uncle who aren't the aunt and uncle who are my college buddies that we were all RAs together. And so that's what, our kids grew up seeing us wear our school colors and go to football games and basketball games and fun things on campus. And that's what they think college is all about. So if you only talk about that, and I'm not saying delude them, deluge them, not delude, also deluge them with everything bad that happened to you in college. Please don't do that either. That's not healthy.
Right. Not if you want them to go.
Like my very worst birthday of my life was during college. Boyfriend had just broken up with me. Terrible. Don't need to, we don't need to go through all of that. But the point is, share 1 or 2 things, that you had that you struggled with, and how you can look back at that and be like, oh my gosh, at the time I was so devastated, but then it turned out this way or whatever. So that when they are going to have bad days, and when they have that time when they are feeling really down, that they don't have the extra burden of letting you down. You're paying all this money for them to go to college, and it sucks. And, it's not only not my greatest years of my life, it's horrible. I hate it. And then you're letting you down, they're letting themselves down. And then you get all those extra layers of anxiety. So best years of your life so far, but still bad days, bad weeks. Sometimes
you say so many things, my head is exploding. So first of all, one of the things you do in the book too is to help students differentiate between sort of average anxiety. You explain what anxiety is for and why we need it. It's adaptive, and then where the line is between kind of quote unquote everyday anxiety and when you need to go see somebody. And what you just said too about how to talk to your kids about college. A colleague of mine who's a disability services director, because that's what I do. I'm not a director, but that's my area. Gave some advice to parents about moving, in a different way during the preparation throughout high school, moving from being, the coach to the cheerleader. And what she said about that I thought was so interesting was, you want to make it comfortable for them to call and say, I did not have a good day. So make sure that they go with the appropriate expectations. I think
And can I jump in on this?
Please. Oh, yes.
Too? So when I give talks, there's a word I make all the parents, we all say it together. And that word is catastrophizing.
Yes.
Right?
Yes.
Okay, everybody,
yes.
say it with me, catastrophizing. Okay, so we do that when our kids send that text. It's always late at night.
Right.
When we get that text that they bombed a quiz, or their boyfriend or girlfriend broke up with them, or they don't belong, or they haven't made friends, we take it not just next level. We we catastrophize. We go from, a little turbulence in a plane to for sure we're crashing and orphaning our children and, devastating the world. We go from 0 to 180. And so we need to recognize it when we're doing it, and we need to recognize it when they're doing it. And this is a big component of test anxiety, by the way. Somebody does poorly on Gen Chem quiz. It's always Gen Chem. Everybody freshman year. They do poorly on a quiz, and then the next time around, they're even more anxious. They do poorly again, and then they go from, okay, I'm going to flunk this class. I'm going to fail the semester. I'm going to lose my scholarship, and I'm going to be kicked out of school, and I am never going to become a lawyer, engineer, teacher, doctor, whatever it is that they want to do. That's catastrophizing. Recognizing that and putting the brakes on that is really important. And so pitch for cognitive behavioral therapy coming at you right here.
Yeah, you made that point in the book.
It is so important that when you get into that headspace that you can't get out of, talking with a counselor. Look, the college counseling centers are outstanding. And this is what they do all day long. And they see the same things over and over and over. Probably what your kid has is not original. Okay. And the good news is that they can help, and they can help them recognize those distorted thinking patterns that lead to catastrophizing. Because it turns out how we handle a situation how we perceive the situation is much more about our gut physical response than about the facts. Learning that whole mind-body connection, and learning how to slow your heart rate down, because when your heart's racing and you're shaking and you're tremulous, you are going to be anxious, whether that's from drinking too much caffeine, which happens, or whether it's from anxiety. If you can slow that heart rate down, whether it's through breathing or cognitive behavioral therapy or a medication that slows your heart rate down, that calms your brain down. So learning about that whole mind-body connection there is really important.
Well, one of the things that I love about what you say throughout this book, especially for the psychosocial stuff, is how to prepare for it and think ahead. You talk about, I think a lot of people would be surprised to hear an MD talking about students with academic struggles. Again, this is the Student Health Handbook.
Yeah. No, they come in, and I'll tell you, they come in with headaches, migraines, insomnia, stomach ache. We see a lot of somatic complaints that are manifestations of stress. And it's not it's in your head, sweetie. You've got physiological responses that are causing an actual migraine from the stress, or more likely from the things that you're doing to self-medicate to help your anxiety. Whether that is,
want to speak to some of those,
alcohol and weed and different things. Those, and then now we're seeing, now you've got gastritis. So why do I talk about anxiety? Because it's first of all, mental health is health, and second of all, because we see all the somatic downstream problems from it.
And just for those who've not, I typed it into the comments, but for those who've not seen or heard the term somatic before.
Oh, sorry, bodily.
So when what's happening up here creates stuff down here.
Yes.
Or I guess sometimes still up here. Right, if it's a migraine. So there was so much that which I, again, as a learning specialist, appreciate. It's anticipating all of this stuff, encouraging students to go to the tutoring center. So for those who are watching this who don't know who I am, my name's Elizabeth Hamlet. I am the author of 7 Steps to College Success, a pathway for students with disabilities. I guess we'll just put this in here.
I had that somewhere here, and that I don't know where mine is.
That's all right. We got a copy.
Oh, it's fine. It's because I moved it behind me.
I talk to audiences and readers about all of the things that students should be doing proactively. And, you know, one of the things, you know, you talked about college counseling centers. So perhaps there's a college that doesn't have one, you know, maybe not.
Where people can't get in.
Yeah, that are not residential. I mean, from the disability standpoint, I encourage folks to look at disability services offices when they are looking at colleges. Honestly, not primarily, because I think a college has to be a good fit. As you said, if the whole culture of a school is everybody goes to the football stadium on a weekend, and that is really, really not your scene, you can find other places, other activities, as you said, but maybe it's not what you want.
Right. And so I think that's a regret I hear a lot both ways.
Yeah.
I've had people that picked a much more cerebral school, and then they got there and they still thought there was going to be more rah-rah spirit stuff, and either they didn't find it or it wasn't there. You know, that's why I always encourage people to get feet on the ground, walk around campuses if at all possible before going there.
And now there are all these great websites where students themselves post about. There's ways to learn about a school's culture if you can't get there on your own. But, you know, campus counseling centers, as you said, parents should be aware. It can be, and certainly after the pandemic, a lot of it's just sort of baseline that a lot of students have anxiety at a certain level. And so it can be challenging to get appointments at times. Students who are working already with a therapist at home should be asking about whether that therapist can do telehealth. That continuity of care, which I think you also talked about, is really important. And also because they may need that person to be available to them in case the campus counseling center can't see them soon enough, B, frequently enough. And often, C, they will refer students. They will cease to serve students after a certain amount of time.
There's So certainly that's very variable on campuses. I think the best thing to come out of the pandemic is telehealth for mental health. To me, that's so huge, because a lot of times students wouldn't go because they didn't want to go. I don't want to be seen walking into that area, you know. It's like, oh my gosh. but it was a real barrier.
I'm so sorry. All of this looking ahead piece. So one of the things that you can do this summer with your student is get on the school's website, find the counseling center, show them where it is on campus, find the tutoring center and show them where it is on campus. And maybe, you know, they'll probably want to you know, abandon you as soon as you drop them in the dorm and get all their stuff in the room. They probably will say bye. So maybe you won't get to walk them around and show it to them, but at least show it to them on the campus map. Let them know, again, this stuff is there because we expect students to need it.
And I always tell students, I'm like, anyone who is hesitant, I'm always like, are you kidding? This is part of your tuition, man. You paid for this. Like, take advantage of it. There's a lot of health centers have different like biofeedback things or relaxation tapes or massage chairs. There's, you know, been an increase in a lot of that so that students can use it. One thing I also really want to emphasize is that a big difference between high school and college. Oh, my brain's going 2 different directions.
I know. We'll get to it all.
One really big difference. The biggest difference that students will tell you is that they have so much free time that they did not have in high school, because they're not sitting. They're not just in a building for 8 hours. You know, they've got a class here, they've got a class here, and they've got these breaks in between. So there's a lot more downtime, which can be good and it can be bad. But that's their biggest change. But the other thing is that the people with the highest grades almost always go to tutoring. Almost all of them. And meet your professors early. We had a rule, and my dad was a professor growing up, a dean, an administrator, a teacher. We had a rule for me, made it for our kids. The first 2 weeks of every semester, all 4 years, within the first 2 weeks, you go to office hours and you meet every one of your professors. And I will tell you, I have so many friends that are professors, so many, and they all say, yes, do that, because what they hate is you coming in crisis at finals, and they don't even know who you are. You're in, this big classroom. They don't know who you are. You haven't shown any interest from their perspective the whole semester, and now you're going to show up in grade grub and ask, that is so not cool. So go in and, look for conversation clues. If you walk in their office, it'd be nice if you look them up ahead of time, and if they do some kind of research or something, you could maybe comment on that. But if nothing else, use context clues, look at their walls. If they've got a picture of them skiing with their family, say, oh, you like skiing? Or where do you ski? Ask something personal. You show that you are caring about them as a human, not just as the person who's going to give you a grade. And I think that is, if you will do that, you will be so far ahead of your peers. Very smart.
And as a disability services person, almost all of my colleagues want students to communicate with their professors, even if the notification to professors about their accommodations happens electronically or through email. They do want you to go and meet with those students, the professors, just to say, my name's Elizabeth. I've been, approved for extended time and permission to use my laptop. And that way, if you happen to have a professor who has not gone through training about disability services and says, oh, but it's not my class, you can't have that, you at least have had that conversation very early and can go right back to disability services and say, Professor so-and-so said I couldn't have it. That's our job then to talk to your professor about the disability laws. Oh, we have a question. A parent has asked, in general, do you see more female students or male students in the campus health center? It's an interesting question.
Honestly, I never felt like there was a big difference. I will say something nice about the millennial generation is that, 10 years ago, I definitely saw more females coming in complaining of anxiety, or, either anxiety, depression, insomnia, that kind of thing. And that's just not the case anymore. I mean, they're fine talking about it. They understand that it's just part of mental health. They all know that we've had terrible stressors with pandemic and guns and just anger at one another because of the polarization in our political world. So I really, it's about the same. But I will say, also across the board, gender neutral, please encourage your kids to not wait till they're in crisis to come in. That's true whether it's mental health or whether it's a sore throat that, they thought they were going to just tough it out and now they can't swallow. And, things do happen. Like, we're in college health. We're there for a reason. We want them to come in and not wait till the very last minute, because also, you may not get in right when you call. I mean, you will if you're not able to swallow or, whatever. But don't wait to crisis, mental or physical, to come in.
And actually, I think that speaks to, and what I love about this book, again, it keeps encouraging students to think ahead and be proactive, the time management piece. And in the comments, I've put a link to the page on my website, because I'm a learning disability specialist, about time management and how to handle all of that free time, because it is a challenge. But to your point, students sometimes think I'm the only one who needs to go to the writing center, until they try to go to the writing center and find out everybody else is going to the writing center. And sometimes you need to make an appointment 2 weeks ahead of time. And so I understand that a lot of students don't want to ask for something, or go seek help until they really need it. But the moment they are struggling with something, that is the time to make an appointment, and not to wait. And you can always cancel it, and please cancel it.
Yes, yeah,
Don't,
definitely
don't no
cancel. Don't
show.
no show.
Yeah, but you know, as I said, people who follow me often are doing so because of they have a student with a disability. So when it comes to
Mhm.
campus health centers, sometimes parents want to know, like, will you hold my kid's stimulants because I am afraid that somebody's going to get under her bed and take her meds. So what kinds of stuff, at least where you work, did you do for students with disabilities, not do for students with disabilities with chronic conditions?
Um, uh, so on the stimulants, I will say this: make sure that your kid has a lockbox. Um, um, Easiest, not a key. Usually, it's easiest to have like the little slidey numbers on it. Have a lockbox where they do keep the bulk of their prescription in there. For ADHD, it can be very helpful to have the week. For even not ADHD, it can be very helpful to have the little weekly pill distributor,
Mhm.
because something that we see, especially for kids who weren't in charge of their medications when they were home, now they're suddenly in charge of their medications and they're forgetting, or they, especially like during midterms and finals week, where they're up late studying. They may take their ADHD med before the test. They come back, they sleep, they wake up, they shower, they're kind of like starting their day over. They take a second one. And then now their heart's racing, and so they come in to see us because they took too much. But anyway, those pills do get stolen. They are sold. So in general, you want them locked. But in general, you can probably keep a 1 week supply, in a drawer next to your bed or in your bed or whatever, wherever it is that they're going to keep it. I wouldn't keep that really in a public shared bathroom. I would
Mhm.
keep it closer than that, because people borrow them.
Mhm.
So you do need to be extra careful about that. In terms of administering medicines, I mean, at a really small school, I don't know, maybe, but
Yeah.
probably not.
I
Um,
I don't think so either. So it's important for parents and students to ask questions about this stuff when they're looking at schools, adding schools to
yeah.
the list and doing the tours. Yeah.
And speaking of being prepared, something you can do this summer is, for one of the many appointments your kid is going to need this summer. And I'm telling you, think about it. If you
Oh,
wear
gosh.
contacts, you need to go see the eye doctor. You need to have a current pair of glasses to your current prescription. I know they only wear contacts. They never wear their glasses,
Oh, yes.
except for when they scratch their eye or they get pink eye. And then they have to have glasses, and then they don't have them with them at college. So please do that. So there's that. Get their teeth cleaned before they go off to college, because that's a thing. Also, get them an electric toothbrush. That's from a word from your dentist and your dental hygienist, because that really helps. But they have all these different appointments that they might need this summer. Let them make the appointment. B, most importantly, let them fill out the paperwork.
Yeah.
I know my kid can't do that. Yeah, they can, and they're going to have to. And yes, you might be on the phone texting with them, but I'm telling you, you don't want the first time that they struggle with doing all that. You don't want it to be when they've got 103 fever and shaking chills, or they're throwing up, or they have a concussion, or they're in a lot of pain because they just sprained their ankle really badly or broke their wrist or whatever. You don't want it. You don't want that extra pain of trying to wade through these things for the first time on your own to be
Mhm.
under those circumstances. So do it now. A parent suggested to do, which I think is a great suggestion, to do it in a Google Doc that you share with them. So you can, print, you can get new patient paperwork. And I'd get the new patient one because, ultimately that's what they're going to need when they go to the health center on their own the first time, whether that's an urgent care, whether it's on campus. So get that and fill that out, including their immunizations, their medications, their allergies, their family history. They may not know, Mom, that you had your gallbladder removed before they were even born. But if you've got a daughter and a mom who had that, she needs to know that, because if she's got really bad abdominal pain, that's something she should know and the doctor should know to learn about that. So fill all that out this summer under a low stress circumstance so that they've had the experience of filling it out. They know what a guarantor is. They know that they have to have their mom or dad's social security number in addition to theirs, because that's part of the form.
Yeah.
All that stuff. So that is something you can do that really will help them prepare. Also have them do a refill of their medications.
So speaking of helping your student and phone calls and texts, talk to us, and I'm going to put this in the comments, about HIPAA and what it means. It's 2 P's and an A, right?
Yep.
Okay.
So
health insurance,
health information, privacy protection. I should know that.
No,
it's a quiz. It's a quiz.
Yeah.
Anyway, so really what you need to know is that if your kid is 18, we can't even tell you, the receptionist cannot tell you if they are actually at the health center, even though you're looking at your phone and you've got Find My Friends and you're freaked out because you see that they're at the health center and they're not answering your text. You can't call, and please don't do this. Parents do this. And understand you're panicked, especially if your kid's got special needs and you don't know what's going on. I mean, it's a natural thing, but calling and yelling at receptionists saying, I know they're there, I can see them, you got to just confirm for me, or hand the phone, we can't. That is a HIPAA violation. So you can get these forms, fill them out ahead of time. There's a service that I personally use. I don't have any financial connection with them, but I've been recommending them for years because it's what we did. It's Mama Bear Legal Forms. But you also can get them. You can get some of these forms for free online. I just did it because it was convenient, and you can do medical power of attorney and separately the HIPAA form. And it really only comes into play, to be perfectly honest, if your kid is unconscious. But I will tell you, I have. Part of it's because my friends in the community reach out to me when there's a crisis, but I have so many friends whose kids were in a car accident or a scooter accident. Don't let them on those scooters.
They're everywhere where I live now.
I know. Yeah. But they were unconscious. And when they're unconscious, they can't give consent. If they're conscious and they choose to give consent for you to talk, they can sign a HIPAA form right there. It's not a problem. You're doing this for worst case scenario if, heaven forbid, your kid ends up unconscious somewhere.
So somebody's asked, is there a general new patient paperwork that we can find to fill out?
Honestly, just look for just any doctor you can think of in your well, they don't even have to be in your community since it's online. We pretty much all have, in primary care anyway, we pretty much all have the same forms. So you could look up like a sports medicine clinic or just a local urgent care. Almost everybody now online has new patient forms, and you don't actually have to have an appointment to download them. Some you do, but others you don't. But,
yeah. And for those who know about FERPA, which is the Family Education Rights Privacy Act, which is what dictates the information you get. It's basically things that are not covered by HIPAA when they're at college are covered by FERPA.
Right.
Signing FERPA, if your student signs FERPA, it doesn't mean that they'll get to answer questions over at the health center, because HIPAA is a different law entirely. And also for those who are interested in FERPA, that is, for those of you who haven't sent a student to college yet, the only thing the college will send you without, or share with you without your student's consent, is the bill. So you may want to have your student sign FERPA. Different offices sometimes at colleges, like the bursar's office might have something, and the counseling center might have their own release. So don't assume that release signed someplace on campus also is good elsewhere.
Yeah. And HIPAA is, you were right, Health Insurance Portability and Accountability Act. I should know that.
Oh, I cheated. I looked it
up. We talk about all the privacy stuff. And the bottom line is their doctor, once they're 18, their doctor can't talk to you unless they give permission, and you can't coerce the doctor into giving you information. It doesn't work that way.
And if you have, if you're watching this and your student is not currently a high school senior, you'll find this even with the pediatrician. If your student
or family medicine physician
or family medicine, once they turn 18, the doctor is going to again give you the bill. but not necessarily share anything that they've talked to your student about without your student's permission.
We do also remind students that, like, don't ask your doctor to commit fraud. They'll be like, can you test me for an STD, but just say you're testing me for strep? Like, no, nope, not going to lose my license over that. Isn't happening. So the fact that we can't say anything doesn't mean that you aren't going to get a bill that tells you something maybe they don't want you to know.
Oh, that's tricky. Okay, that won't happen with disability services. We don't bill anything. So just to wrap this up, this has been such a great conversation. Folks, in case you're missing it, please get the Ultimate College Student Health Handbook. And at the back.
Oh, yes. Make your own first aid kit.
Right. DIY. So Dr. Grimes is on TikTok, folks. There you go. And you can watch this, the making of this first aid kit on TikTok. Guys, send your student over to her TikTok that she talks about how to deal with hangovers and all sorts of things, that it's much easier to let them watch that because they're on the app anyway, than talk to them about it. And again, maybe it's something where you say, hey, I saw this thing, and it might be an opportunity to have a conversation after your student views it. So I had asked you when we prepared for this conversation, there isn't one all be all end all kit that you've ever seen. Somebody just ordered the book. Thank you, Cindy. Kit that has absolutely everything you would like to see in there. So
honestly, yeah, everyone asks me, why don't you sell the first aid kits? There's a lot of reasons I don't. I really should have. If I wanted to make money, that would have been a very good idea, but no. So I will tell you, I literally have the breakdown of it in the back of this book. That was my condition of doing this book with the publisher. Like, it's non-negotiable for me that we include that in here, because I want you to be able to make one for your kid. And the reality is, like, you need one non-sedating antihistamine, for example. You know if Allegra, Claritin, or Zyrtec works better for your kid, or the generic. And I can't tell you that. You know that, and you just need one, and that needs to go in there. But if you're creating these kits, I will tell you, if you create a whole kit with everything in there, unless you use like sample sizes of everything, they'll cost $100 to make this kit. Now, that will pay for itself because they'll be able to take care of themselves at 2 a.m. and not have to seek help for certain things. So I feel like it's very worthwhile, but it's just, you're going to save them so much grief if you have stuff in there. And you need painkillers for fever reducers. Please get them a decent thermometer and something, it used to be the oral digital thermometers were what I recommended. And honestly, they got super cheap and bad quality during the pandemic because they were being mass produced, I guess. I don't know why, but they were not accurate. So I can no longer recommend that. Plus, now that we have all the ones that you can just zap the forehead, frankly, they're like $30, but it'll last them, 2 decades. They're good quality things, but spend the $30 on a good thermometer, because if you call the student health center and you're like, I have a sore throat, I've had a sore throat for 2 days, and they're like, do you have a fever? Well, I don't know. I feel like I did. That's not going to get you in. You call and you say, I had 102.7 fever last night. That you just raised yourself up to get in.
You just jumped the queue
on the list. Yeah. It needs to be true. But so having that, and I like having the pulse oximeter in there. That's the little thing that clips on your finger, because getting an accurate, quick pulse reading is really also another great data point to share when you call the health center, because that kind of tells us, are you dehydrated? It's these little guys where you clip on your finger. And it's less about the oxygen saturation, although that was certainly important with COVID and can be important with other, with asthma or pneumonia. But really having an accurate pulse is nice. So that's a luxury item that I would put in there.
So if we were doing bare bones, what would you recommend go into that kit?
So bare bones, thermometer.
Okay. And I love the way you said, like, wine, not the cheapest, not the most expensive.
Yeah, you don't need a $90 thermometer. Just a $30. I actually Let's see what brand I have in here. I have like 5 different ones.
And she is
This
not,
is
this talk is not sponsored by anybody.
Oh no, no, I don't have.
It would be nice. Somebody should sponsor you, Dr. Grimes.
You know, it's on the list maybe, but I feel weird about it. Medicine, you know, we are so strongly, and I've been in academic medicine. I'm a clinical instructor for UMass Medical School, long distance, before it was cool. And you know, it's so ingrained in us to not no drug reps. No, the thought of being tied to this financially is just too weird for me. But anyway, like this one is literally, it says Kroger on it, but this is a great thermometer. I have one that's, I don't know, I could put it in a link or something later if you wanted, but you know, a good thermometer is an absolute mess. ACE wrap is an absolute mess. Nobody has ACE wraps. And I always put 2 ACE wraps. I like to get fun color ACE wraps. That's my little splurge. The ACE wrap, super important. Good Band-Aids. What do I mean by that? I mean, it's like, I love anime. I've got a daughter who's an animator. I love cute little fun Band-Aids, but what they need are the good Band-Aids that wrap around the finger. They look like an H shape. They're finger and knuckle Band-Aids, because I'm telling you, if you've got an architect major, they really need it. They get cuts when they're doing all their little things, but always on the non-dominant hand. You can always tell which handed they are because the cut's on the other hand. But
is good
Band-Aids, including blister Band-Aids. That first week of school, they have no idea how many miles they're going to walk. And girls are the worst because they'll get cute shoes that are, you know, strappy sandals or whatever, and get just terrible blisters. Guys get them too, but less so. That I have a gender bias on that one. So good Band-Aids. Both Tylenol and Advil, generics are fine, acetaminophen and ibuprofen, but they work differently and they work well together. So that's a little fun fact. And an antihistamine, non-sedating, a topical steroid cream, so that if they get an itchy rash, that they can use that. Do not get Benadryl cream. I don't even know why it's still made topically. It's not effective. Don't use it. Okay. Don't include that. Oral Benadryl, really the only thing we use it for. Occasionally we'll tell people if it helps them sleep, they can try that. That's actually not recommended as a sleep medication. That is the Benadryl is the ingredient. Diphenhydramine is the generic name. That is the ingredient in every PM, or virtually every PM medication. So sometimes students will do that, but really, we don't use Benadryl for allergic reactions. We use the other antihistamines. If they get seasonal allergies, put a nasal steroid spray in there. I like to include Afrin, which is the spray that immediately works up your nose, but you only use that, honestly, what I use it for is nosebleeds. If a student has a really severe nosebleed that's not stopping after 10 minutes, you can actually use the Afrin after holding pressure. Then you use it, and that almost always will stop it, and that will save them a trip. That will literally save them a trip to the doctor's office. You don't use it for colds and stuff. You should only use it for like 2 days max. Those are the immediate must-haves.
Sure. And as we said, the lockbox for prescription meds.
Yeah, if your kid has ADHD meds, they need to have a lockbox.
Yep. Well, I can't thank you enough. Again, just one last time, Ultimate College Student Health Handbook. I really enjoyed it. As I said, I'm going to keep all my tabs in here for when I have another migraine, because I learned about, using Tylenol and Motrin, together, and Aleve being longer acting. But it's a wonderful book. It is the really good time to buy it now. But whenever you end up watching this video, whatever time of year it is, it's a great time to get this for your college student. Have them have it, you guys, and then you have it so that when they call you, you can say, well, look here on page 149, the coughing. Yes, let's talk about that. So buy 2. Anyway, thank you so much for your time today and for writing this wonderful book. You can follow Dr. Grimes. Oh my gosh, TikTok, Twitter, Instagram. Have I missed any platforms?
Yeah, I'm not super active on Instagram. I am on Twitter and Instagram. I'm Jill Grimes, MD, just one word. And then on TikTok, I'm TikTok.collegedoc.
And what is your website so I can put this in the comments?
Jill
too?
Grimes, MD.
Well, that makes
Everything
sense.
was Jill Grimes, MD till TikTok, but then, I had to have it rhyme. So TikTok got it. Easy
I
to
know.
remember.
You did a great job. Well, thank you so much. And thank you for joining us. I hope you all found this really informative.
Thanks so much.